We're back at St. Croix Orthopedics in Stillwater, and with me is Dr. Jason Dieterle, and let's talk shoulders. And lately I've been running into so many people with shoulder problems, even my daughter grabbing a tow rope says, oh, my shoulder hurts. I'm sure it's fine, but let's talk rotator cuff. What is a rotator cuff?
Well, rotator cuff is a series of four muscles that form a tendon that goes around the top of your arm bone, and it helps to position your shoulder and helps to lift the shoulder.
Okay, so what does the pain feel like if there's something wrong there?
Well, it's a very common injury to tear your rotator cuff, and the pain that people will experience is pain that goes down the side of the arm, pain with reaching overhead, lifting. A lot of times it's a pain that will wake people up at night. Sometimes you can even get a grating sensation in your shoulder or rubbing sensation, or weakness when lifting things up to put it in the cupboard or changing a light bulb.
How can you tear a rotator cuff?
Well, there's a couple ways to go about it. You can actually injure your rotator cuff, say in a fall or lifting a heavy object, or rotator cuff can actually wear out over time like anything else in the body, and in that sense you can get a partial tear, or the rotator cuff can just be inflamed, and a lot of times the symptoms are very similar.
When somebody comes in, do you know right away that it's a tear, or how is it diagnosed?
Well, sometimes it's hard to determine, but your doctor will examine your shoulder and try to figure out where the pain is coming from, check your shoulder for weakness and the range of motion. And if in fact a rotator cuff tear is suspected, generally the next step is to get an MRI, as you cannot see the rotator cuff on regular x-rays.
Okay, so I tear my rotator cuff. What's next? How do you treat that?
Well, based on your exam and the MRI results, there's two different ways to go about it. If the rotator cuff is just inflamed or partially torn, then they don't need surgery. Not all rotator cuff injuries need surgery. Those can a lot of times be treated with physical therapy or a cortisone shot, and they get better. If it is torn, unfortunately, the rotator cuffs do not heal themselves. So if it is a complete tear, usually those require surgery.
Tell me about the surgery.
Well, the surgery is basically reattaching the tendon back to the arm bone. It's an outpatient surgery. You go home the same day. You wear a sling for about 4 to 6 weeks, and then you go into a series of physical therapy to get your range of motion and strength back, and it's about 4 to 5 months till you're back to normal.
All right. Thank you, doctor.
All right, thank you.